Okay, hello everyone. I'm going to try to make this as quick as possible, but I'm going to be lecturing on psychological therapies, in particular mainly psychotherapy today. So we're going to talk about really the four main disciplines within psychotherapy. So let's get started by looking at just a brief background of where psychotherapy and psychiatry actually developed. So Dorothea Dix and Philippe Pinel are really the two key individuals who helped develop this discipline. So Dorothea Dix, she is actually from Hampton, Maine in 1802, and her father was pretty absent in her early childhood, and her mother suffered from depression. Her father was an alcoholic, and so she had a rough childhood. However, in the 1820s, she then traveled to the West Indies, and there she was a missionary. She taught as a school teacher to children and tutored. And then eventually she came back in the 1840s and began a job as a Sunday school teacher at East Cambridge Prison. And there she really saw what was happening in these mental institutions, in these prison institutions. She saw the unbelievable abuse, cruelty that was actually occurring to the inmates, and so she wanted to do something about it. She wanted to do something about the lack of sanitation, the lack of food, the lack of heat and bedding these individuals were getting. Sexual and physical abuse was present, and some of the methods they actually used to treat the mentally ill at that time were like burning, castration, mutilating, blood transfusion through like animal blood transfusion, and this other thing called trephination, which was where they would actually take out and remove a bone tissue from your skull with a circular saw. It was pretty intense. So death rates at that time and the beginnings of psychological mental institutions were really high. Death rates were quite high after she came in, and Philippe Pinel throughout Europe and throughout the United States. Death rates decreased by 5 to 6%, 5 to 6 times what they were at her time. So Dorothea Dix was very crucial for the development of psychiatry. Let's look at the four main types of psychotherapy that we'll be looking at today, okay? And those are psychoanalytic, humanistic, cognitive, and behavioral. So the first three there, psychoanalytic, humanistic, and cognitive, are more insight therapies. Behavioral therapy, on the other hand, it's less indirect and it's more direct. So there's more action and external. There's more action and external involvement in behavioral therapy. Biomedical therapy looks at biological factors, so chemical imbalances, hormonal imbalances, and tries to treat things through generally medicine, so drug therapy. Or the other one is ECT. An eclectic therapy is where you kind of blend multiple therapies together, So it's probably your most common because generally there's not just one therapy fits all for anyone. So psychoanalysis, as we've looked at Freud, we've really began to understand that it's the study and the theory of the unconscious, in which we're trying to repress our memories, and through this repression of childhood experiences, a lot of times it leads to abnormal behavior according to psychoanalytic approach. So the aim is to bring those repressed feelings up from the unconscious and make us aware. And the method that's used for this is called free association, which is a method of exploring the unconscious, where the patient lays on the couch and spontaneously reports all their thoughts, feelings, images that are in their head, And through this, the psychoanalyst will ask questions to kind of encourage that flow to continue. And then they will make associations. They'll make associations off of what the client is saying. Okay, so there are 3 key steps in free association therapy: resistance, interpretation, and transference. So during free association, your mind may go blank, or you may be unable to remember certain details. And what happens is a lot of times the patient will attempt to conceal disturbing memories or make jokes or try to change the subject. And this is called resistance. It's the blocking of unconscious anxiety-laden material. You don't want to deal with those things, so you'll resist them. Okay. Next, the analyst will note your resistances and provide insight into their meaning as interpretation. So the interpretation of it by the therapist analyzing your dreams, analyzing your resistances, and trying to make sense of it all. This is where it's really very direct therapy to give you insight onto what you're actually experiencing and those hidden concepts or conflicts in your repressed memory. And then you have transference, which is the last part. Okay, transference is, Freud believed that this step was really important to help gain insight to past relationships. So transference is the process by which the patient projects or transfers their unresolved conflicts and emotions onto the therapist themselves. So the therapist that may be directed or projected with anger or sadness or blame. Now, when we're evaluating the entirety of psychoanalysis therapy, these are the 3 things we have to look at. Okay, so psychoanalysis, one, it's pretty hard to refute it because you can't prove it and you can't really disprove it. The second one is it's expensive. Okay, it generally takes a very long time. It's time consuming, and it has a lot of drawn out sessions. So this is definitely a setback. And the third thing we need to understand is that it's generally used with anxiety issues. Okay, a more common type of psychoanalysis evaluation that's not free association. It's called psychodynamic therapy. And psychodynamic therapy is less expensive, it's less extensive, and it's face-to-face with the patient and the analyst. So instead of being removed from the patient's line of sight, the therapy focuses on childhood conflicts. It focuses more on childhood conflicts than the unconscious conflicts. Okay, the next type of psychotherapy we're going to look at is humanistic therapy. So with humanistic therapies, the humanist psychologist doesn't view their client as irrational or evil nature. Instead, the humanist psychologist believes that people are innately good. And so it's all about helping the individual find self-awareness and self-acceptance so that they can boost their self-fulfillment in their life. So you have to, in order to do this, the goal of humanistic therapy, in order to reach that self-fulfillment, you have to reduce growth and pending inner conflicts and provide your client with a new positive inner insight. So Carl Rogers is the one who's most associated with this type of therapy. And he encourages therapists to exhibit climates that meet 3 conditions: acceptance, genuineness, and empathy. A good memory tip for this is age. So it's called person-centered perspective or client-centered perspective. You might see one or the other on your test. And it's a much more non-direct environment than psychoanalysis is, because the client and the therapist are engaging in finding solutions to the problem together. And this is what Carl Rogers calls it active listening. Active listening, in which the therapist echoes or rephrases or reclarifies what the client's saying in a non-judgmental tone. And what this does is it helps the client address the problem in a more productive way, to help them build their self-awareness, to help them be a part of the therapeutic process in their healing. So it's less direct, it's less directive than psychoanalysis.
I am very fortunate, and the client is very fortunate, if I can feel I really accept you fully just as you are. Sometimes that's very difficult. I held an interview with a young man in South Africa. I didn't know anything about him. It turned out he was an officer in the South African Army. Now, for me, that meant it meant that I stretched my empathic abilities to their very limit to try to be with him, to try to understand him, to try to be caring toward him. I didn't feel I did too well. And yet, I've learned since that interview really changed the course of his life. So, I feel that if I can be genuinely understanding, try to listen not only to the words but to the meaning, trying to understand the person that's hidden within each one of us, that's helpful. If I really care about this person in an unconditional way, that's helpful. If I can really be myself in the relationship, not a professional expert, not a, quote, psychologist, not a psychotherapist, just me in that relationship, that's helpful. All those things are possible, and when they come together, that creates a very powerful climate for change, for growth, for drawing out the potential of the client.
So, when we look at the evaluation of humanistic therapy, we see that it has helped encourage individuals and allow them to take part of the role in their path to health, in their path to healing. But it's still very subjective, and you can't really measure it because it's just, you can't scientifically measure self-awareness based on these concepts of self-actualization and self-transcendence. So it is good, though, in a sense, because it's helped get rid of some of the stigma that therapy generally produces. You know, we oftentimes look at therapy as a very negative approach. So humanistic therapy has helped with that stigma and kind of remove that stigma from psychological therapy. Okay, next let's look at behavior therapy. Okay, so behavioral therapy applies learning principles to eliminate the behavior, the unwanted behavior, the maladaptive behavior. And it criticizes humanistic therapy because self-awareness isn't enough. You can be aware that you have test anxiety, but still not know how to get over that test anxiety. So self-awareness, while it's important in the process of changing our behaviors, it's not enough. We need something else. So a lot of times this therapy is used to treat anxieties, phobias, OCD, and eating disorders. So behavioral therapy believes that it's the behavior that's the problem, it's not the self-awareness. Okay, and it looks at these key aspects. Thoughts create feelings, feelings create behavior, and then behavior reinforces our thoughts. The three main methods that you really need to understand within behavioral therapy is classical conditioning, operant conditioning, and observational learning. Those are crucial to behavioral therapy if you're ever going to implement it. And I actually used to use behavioral therapy in a lot of my methods when I worked with children with autism. So there was a lot of reinforcement involved in teaching my clients to understand how to respond appropriately in social settings. So classical conditioning techniques. How do we actually recondition maladaptive behaviors? We do it through something called counter conditioning. So counter conditioning was actually developed by Mary Jones. She's really the founder of these behavioral therapy techniques. And she focused on getting rid of these maladaptive behaviors that are reflexive. So how do you retrain your body to respond differently to unconditioned stimuluses so that you have a different unconditioned response? And so bedwetting, O.H. Maurer developed this counter-conditioning technique for bedwetters, chronic bedwetting, in which the child sleeps on a liquid sensitive pad that's connected to an alarm, and whenever moisture triggers the alarm, it wakes the child. And with sufficient repetition, after you do this over and over and over and over again, eventually there's an association made with the bladder relaxation, and it stops the bedwetting eventually. So it's pretty effective, and they've seen that it works 3 out of 4 times whenever it's used and experimented. Exposure therapy is also another very useful method in behavioral therapy. Joseph Wolpe took the counter conditioning methods and looked at how to make them more applicable and how to really revise them. And he does this through systematic desensitization, which I'll show you here in just a minute. But the two main types of exposure therapy are systematic desensitization and virtual reality. So exposure therapy is all about treating our anxieties by exposing ourselves to the things that we fear, the very things that we want to avoid. So let's look at some examples here. And just so you know, systematic desensitization will probably be on your AP exam, so make sure you understand it. It's a type of exposure therapy that associates a pleasant, relaxed state with a gradually increasing anxiety-triggering stimuli, usually used to treat phobias. So you take an anxiety-producing stimuli and you continue to increase that intensity of that anxiety-producing stimuli each stage in a hierarchy system. So once your anxiety calms, you then introduce a higher, stronger anxiety-producing stimuli. And you do this over and over and over and over again until you eventually treat and condition that phobia. So let's look at an example of what systematic desensitization occurs in actual therapy, how it occurs. And the thing about this therapy is it's actually used with cognitive behavioral therapy, so CBT. And you're going to see that in this video, the psychologist actually implementing the therapy is a cognitive behavioral therapist.
Back in England, Jackie has also decided to confront her worst fear, but using a different form of therapy. It may be her only hope of leading a normal life with Angelina.
So, birds, feathers.
Birds, feathers.
Professor Paul Shalkovskis practices cognitive behavioral therapy. He believes this can change the way Jackie thinks about feathers in just one session.
The worst possible fear is not feathers. The worst possible fear is losing it, dying. Now, I'm telling you that that's not what's going to happen, that you're not going to die. So, I kind of need to know whether you want to go the next step.
The next step being show me a feather.
Next step's a feather.
I
It's only a very small feather. Okay, there it is. Okay, I'm just going to put it down there. Okay, just tell me what's going through your mind just now, Jack.
I need to get away from it.
Okay. Out of 100, where is it?
100.
Okay, stay with it then. Okay, now what's going on? One of the things that can be helpful for people to understand is that as anxiety increases, it will in fact level out and will come down again. It won't be able to sustain it. And what we do in therapy is we give them the experience of their anxiety going up and coming down again without them escaping. Okay, ready?
Yeah.
Okay. I'm going to move everything out slowly and controlledly. Okay. So my holding it was worth.
Yes. Because you can put it near me.
Promise you I'm not going to do that.
Oh. Yeah, keep
it
going.
calm.
Keep going. No, stop now.
Okay.
Stop.
I'll stop.
Stop.
I'll leave. Okay. Brilliant.
Jackie's therapy activates the links in her brain between feathers and danger. Usually she'd run away, but now she's forced to sit tight. Her brain starts to make new connections as she learns that her worst fears don't materialize.
Romantic feather, which I'm going to tape down.
Rather than being dangerous, she begins to see feathers as harmless.
Excellent. Okay. Again, being in control of it is the name of the game.
Oh my God.
Stick with it.
No. Because it'll come down.
I know you're there when you're actually taking control in this kind of way as well, you know.
I never ever imagined in my wildest dreams that I would ever in my life sit here holding a feather. Ever.
But it
Right.
did take nearly 45 minutes.
Wow. 45 minutes after 37 years of it.
It's pretty incredible. Now, the last type of behavioral therapy I want to look at is called aversive conditioning. And it's basically the opposite to systematic desensitization, in which you're using classical conditioning to create an anxiety or a disgust towards a certain behavior. Okay, so alcohol abuse could be an example of this, or as you see in that picture, nail biting. Okay, for nail biting, what I could do is paint my nails with a nasty tasting polish that will cause me to become nauseous and stop the behavior. So with alcohol abuse, let's say you're treating someone with alcohol abuse, you could use an unconditioned stimulus, which would be a nausea-producing drug like Antabuse, and pair it with a controlled stimulus, conditioned stimulus like alcohol. And then what that'll do is eventually it'll create a unconditioned response, which will be nausea. And over time, you'll no longer desire alcohol because it creates just the smell or the taste of it creates a conditioned response, which is nausea. Lastly, I want to look at cognitive therapy today. So, while behavioral therapies treat specific phobias and problem behaviors, cognitive therapy is extremely important in the neural connection and rewiring of our brains. So cognitive therapy looks at how to treat depression and anxiety by fixing those faulty thoughts or those negative self-talks we have, which generally lead to our psychological problems. So it's all about it's all about insight. So you're going back to that insight, that internal therapy, more than external. While psychoanalysis look at the unconscious, cognitive therapists look at the conscious. So you're looking at thoughts, in which thoughts affect what we think, emotion, what we feel affects how we think, and behavior, what we act affects how we think. rational emotional behavior therapy, REBT. You'll also maybe see RET, rational emotive therapy. According to Albert Ellis, he believed that most of our problems don't really arise from our situations, but they arise from our irrational thinking. So, for example, your poor SAT score makes you feel depressed. He would argue that it's not your poor SAT score that makes you feel depressed. It's your irrational thoughts of what occurred at the event. So Ellis challenged this common sense interpretation by arguing that our negative feelings, it's okay to feel sad, but when you go into depression, so our negative feelings are actually produced by our irrational beliefs that we interpret with events that occur in our life. So we must change our negative talk with more rational talk, with more rational beliefs, with more positive talk. This often takes a lot of time and patience to really see progress, but it does help us rewire our thinking, our cognitive thinking. So an example of this could be, I'll never get a job because I get too nervous during my job interview, so I'll never get a job. What the therapist is going to do is say, well, you need to change this statement with a I can stay calm, and I am confident during an interview, and I will find a perfect job for me in the future. So it's more directive, and it's less sweet than CBT. So Ellis stated that we must challenge our illogical thinking to really enable healthier behaviors in our life. So the goal is to challenge illogical thinking and enable healthier behaviors. Now let's look at Aaron Beck. Aaron Beck is the father of cognitive therapy, and he believed that changing people's thinking could change their functioning. So this is typically used with people who deal with depression, anxiety, addictions, eating disorders, and anger. And Beck believed that when we allow our minor failings, for example, failing a test, to make us believe that we can never be happy in our lives, then we fall into this cognitive trap that leads us into depression. So what Beck says is that in his therapy, cognitive behavioral therapy, you have to gently question the client to get them out of this state of mind to recover. So you have to help the client see how irrational they're really being. And he does this through a less direct approach. And I want to show you an interview with him, and then I'm going to tell you the differences between CBT and REBT.
Using this cognitive map, they're able to then use a variety of techniques. They could be experiential, they could be insightful, they could be strictly cognitive or behavioral to attack the disorder. For example, at Oxford, there have been about 10 or 12 different disorders that have been tackled: social anxiety, chronic fatigue syndrome, hypochondriasis, panic, and so on. Each of these disorders has its own cognitive constellation. And once the cognitive constellation is pinned down, then one can get the various important techniques that are going to be useful in that. And the approach can be quite different, judging from one to another. For example, in panic disorder, our basic assumption is that people who have a panic disorder are misinterpreting various internal sensations. Now, when the patient comes into the office, the panicky patient is fairly calm. For one thing, panicky people feel much more reassured when they're in the presence of an authority, of a medical or psychological authority. So they will never feel panicky in your office. So what we have to do is we have to produce a panic attack or a semi-panic attack, get the patient then to become aware of the sensations, and at that point, when they're aware of these sensations, they can then relabel them as not a threatening disaster, not a catastrophic thing, but as something that's quite explainable in normal biological terms. But since they're in a very high affective state, the sluices for learning have been opened up, and they can then take the information in, and within a very short period of time, they have reconstructed their entire interpretation of internal sensations. Now, in contrast, somebody who's depressed doesn't have to have the depression reproduced in the office because they already are depressed. And so what one does there is to see the kind of thinking, but in the thinking of the depression is not focused on internal sensations, as it is with the panic, but has to do with their own beliefs about themselves, about their future, and about their past. And so one can deal directly with the way they're interpreting their external events at that time.
Okay, so as you can see, even what he's talking about here goes with that last video I showed you about systematic desensitization and that last therapist and the way that he was helping that woman understand, oh, it's just a feather. I'm being irrational about my fear of this feather. Okay, so you're really helping that individual see that they're being irrational about their thoughts. Okay, now the difference between REBT or RET and CBT is that REBT is more direct therapy, and it's more challenging in the sense that the therapist is the one who's really leading the entire conversation. So if I say, I just feel like everybody hates me. Everyone hates me. What a REBT therapist would say is, no, everyone does not hate you. You need to change that thought, and you need to rewire it. Now in CBT, you're looking at maladaptive behaviors and thoughts being treated more as a hypothesis. So what I mean by that is we test what the client says. So if the client says, everybody hates me, well, the therapist is going to respond and say, what led you to believe that people dislike you? Do you behave differently? Would you behave differently if you felt people loved you more? So it's more of a conversation, and it includes testing that hypothesis together as the client and the therapist discuss and ask questions and conversate. So CBT, I like to say CBT is more sweet. RET is less sweet. It's more direct. So let's evaluate the psychotherapies that we've discussed today and see which ones are used more frequently. Cognitive therapy, CBT, is used by far the most. Okay, cognitive therapy, 49%, behavioral 9%, humanistic 11%, family systems or group therapy falls in 19%, and then psychodynamic 28%. So psychodynamic is actually quite high in terms of use. Remember, it's not necessarily free association that's the most popular, but psychodynamic, which is a more face-to-face therapy. It's not focusing so much on the unconscious, but on childhood experiences. But cognitive wins in terms of the most available therapies. Doesn't mean it's the best. It's just the most available. It's the most used. So is psychotherapy actually effective? This is the big question. Okay. Does the patient really show improvement when therapy is given? Or do you even need psychotherapy? Is time the answer? Okay. Well, it's really not that simple. We look at Hans Eisnick and his research that he did on 48 different patients, or I should say clients, 48 different clients, in which 24 were treated and 24 were untreated. And he saw that, well, actually, they all had about the same results in their improvement and their healing, whether they received the treatment or not. So it didn't really, according to his research, it didn't really show that psychotherapy was that effective. It showed that time was more of the essence. However, this can't really be used as an effective measure. So meta-analysis is a much better approach because it uses many different studies. I mean, you're taking 48 people. We need to look at thousands. We need to look at thousands and many thousands of patients to really get a better scope on whether or not therapy is effective or whether it isn't effective. And what we found is that through this empirical data, mainly through our studies of CBT, is that 80% of the time it shows effectiveness versus those who don't receive psychotherapy, to those who are untreated. Okay, so there are a lot of benefits to it, and you can also see that they say it helps with cost effect. You know, you end up spending less on your medical bills when you get psychological treatment, and you also have long-term healing rather than just a short-term healing by taking pills and medication. So it's a more holistic approach. The relative effectiveness of different therapies. So which therapy is the best? Which one's the most effective? Well, again, you know, there's no one size fits all here with therapy. Each has its own purpose. So there's actually a lot of debate on this, and they say the psychology civil war is taking place right now on which one gets the prize, which one is the best. But really the ones above have different empirical evidence, and they have different disorders that they're most appropriate for. So CBT therapy, however, would win the most used and maybe not the most effective, but the most used and the most available. As I showed you earlier, it's 40% of psychotherapy is cognitive, usually CBT. Okay. All right. Well, that is it for today. We will have our quiz next class, so please do your reading on modules 70, 71, and 72. And then our test will be at the end of the week. All right. See you guys.